Hi and welcome. I'm trying to learn medicine, today interventional cardiology, and afterward we're going to do selected yoga exercises, and if you participate in the selected yoga exercises, that is at your own risk. Now we start at part 3. The main advantage of using and this is about internal anatomy, diseases, and the blood system. The main advantage of using the interventional cardiology or radiology approach are the avoidance of a scarce pain and long post-operative recovery. Okay, using interventional cardiology has advantages. It is a branch of cardiology, so of medicine of the heart, which uses catheters, stents, and balloons to treat occluded veins or other things. Additionally, interventional cardiology procedure of primary angioplasty is now the gold standard of care for an acute myocardial infarction. Additionally, interventional cardiology procedure of primary angioplasty. What is angioplasty? It's now the gold standard. So to do this interventional cardiology with catheter, stents, balloon is the main treatment of myocardial infarction. It involves the extraction of clots from occluded coronary arteries and deployment of stents and balloons through a small hole made in a major artery, which has given it the name pinhole surgery as opposed to keyhole surgery. So it would be keyhole going into the chest and okay, these clots which are occluding the coronary arteries, the arteries which are bringing the blood to the myocardium as the heart, the big muscle which is pumping. That is done through inserting these stents and balloons through the radial artery, I think it is here in the arm, or the femoral artery in the leg. Is it then completely, why not? They are quite big and they are pretty directly going where they should. It's not so much, it's just a meter or half a meter. I don't know, I would say just so much, and it goes pretty straight forward to the heart. So they are then coming in at the leg of the radial artery, and they are then pushed through completely through the artery up to the heart. And then there's a stent brought in, and that stent is now going into the occluded artery, as far as I know, and opens it up, and it stays in there like a pipe. So it's a pipe inserted. And now the artery can't close anymore because there's no pipe. But that stent can also get dirty. I don't know what it's called now. So it's not the end of the whole story. But stents can be brought in balloons, and that is done through a pinhole, through a small hole, I guess, when just at the radial artery or the femoral artery. Instead of, I think the opposite would be we go directly to the heart. Procedures. Angioplasty, where we have it. Angioplasty is an intervention to dilate either arteries or veins. Okay, angioplasty is the intervention. It is not the disease. It is the intervention. So people, the medicines, whatever they call it, the doctors, they are going there and they are performing the angioplasty. Now, what does the sentence mean? Additionally, interventional cardiology procedure of primary angioplasty. Yes, even as a method, it is the interventional cardiology procedure of angioplasty. And this angioplasty is the gold standard of care for an acute myocardial infarction or heart attack. Angioplasty is an intervention to dilate either arteries or veins. Percutaneous coronary intervention, PCI or coronary angioplasty. The use of angioplasty for the treatment of obstruction of coronary arteries. Now we have to find out the difference between occluded and obstruction. For use of the angioplasty for the treatment of obstruction of coronary arteries as a result of coronary artery disease. A deflated balloon catheter is advanced into the obstructed artery and inflated to relieve the narrowing. Certain devices such as coronary stents can be deployed to keep the blood vessel open. Various other procedures can also be performed at the same time. After a heart attack, it can be restricted to the culprit vessel, the one whose obstruction or thrombosis is suspected of causing the event, or complete revascularization. Complete revascularization is more efficacious in terms of major adverse cardiac events and all-cause mortality. PCI is also used in people after other forms of myocardial infarction or unstable angina, where there is a high risk of further events. The use of PCI in addition to anti-angina medication in stable angina may reduce the number of patients with angina attacks for up to 3 years following the therapy. But it does not reduce the risk of death, further myocardial infarction, or need for other interventions. We don't have the time and I don't have the voice to go through it now in detail. What means in the next part, we could actually do it as a separate part. That is so much. Just to, maybe we're going to split it actually up. The next part will be learning interventional cardiology. So interventional cardiology, PCI, percutaneous coronary intervention, or coronary angioplasty. We're going to call it long and the short one. Percutaneous coronary intervention, PCI. Okay, and the next part will be then, as I said, interventional cardiology, PCI, percutaneous coronary intervention. That means you have to search for that video. But whenever we will do the next video to medicine and that subject comes up, I'm going to tell what we did in the other video, providing with this video. Now, if you were here for medicine or interventional cardiology, you can go directly to the next video. You'll probably come back to interventional cardiology for the other things written on the page. But we're going to talk maybe so long about that. Why not have it in the title somewhere? You can go directly to the next video if you're here for that. We're going to do the selected yoga exercises now. If you participated in the selected yoga exercises, that is your own risk. Feet are standing together, for breathing in with the arms up. And out the arms again down. The eagle's wings. Breathe in and lift the arms up. And breathe out, let the arms down. Again, in the arms up. And out the arms down. Again, in the arms up. And out the arms down. And doing the trap in the morning. Breathe in, lift the arms up. Breathe out, let the arms down, out the chest to the sky, lean back. Breathe again in, lift the arms up. And breathe out, lift the arms down, out the chest to the sky, draw the shoulder blades together. Again, in the arms up. And we're going over to the fur in the wind. The reed in the wind. Breathe in. And breathe out and lean back, the reed in the wind. Again, in into the middle. And out and back. Breathe in into the middle. Now we're doing the fur in the wind. Breathe out and lean to the side. Breathe in into the middle. And out over to the other side. Now we're doing the drill. Over cross the arms, intertwine the fingers and reach high. And out, reach to the front and hold over the back. Breathe again in, lift the arms up. And change the position of the arms and the intertwined fingers and reach again high. And out, reach again in front. And hold the back. Breathe again in. And out the arms down. Now we're doing cat and cow, standing cat and cow. Make an inch space between the toes or the feet. Lean onto the knees and breathe in. And out and making a head with the back, the cat. Breathe in again into the middle. And out. Make a belly with the back of the cow. Again in into the middle. And out. Make a head with the back, the cat. Again in and out, the cow. In and out. We're coming with the jump back up, making it top. Shoulder we're going directly on with a chair. We're lifting the arms up and we're breathing in, we're coming up onto the toes. And breathe out and we're sinking slowly down. And breathe in and come up again, still onto the toes. And out again down. And breathe in, come up again. And out, bring the arms down. We're doing the down diving dolphin. We're going down, both legs straight. Breathe in, bend the right knee. Breathe out, stretch only the left leg, thumb arm it. Breathe in and change.
And out and stretch only the right leg. Again in and change. And out and stretch left leg. Again and change. And out and stretch the right leg. Again in. And out, both legs changes. We're doing the penguin. Breathe in and lift the right arm up to the sky. Bend the left knee and look up over the shoulder to the right hand. Breathe out. Breathe again in the hand in. And out and down. Breathe in, lift the left arm up to the sky. And breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe again in the hand down. And out and down. We're doing the pelican. Make a hand with space between the toes. Shift the weight to the heels. And breathe in and go down. And out and up again. Again in and down. And out and up. Again in and down. And out and up. Now take hold on the elbows. And we're rocking gently from side to side. The trebuchet is counterweight. And both legs again down, close the feet. We're coming halfway up. Breathe in, straight back, monkey half lift. And breathe out again down. Breathe in again, halfway up, monkey half lift. And out and down. Breathe in, lifting the arms up. Bring the heels and shoulders wide apart, the toes are pointing outwards, and we're sinking down, breathe out. Place the heels against the inside of the knees, the garland pose. Breathe in and straighten up the back. And out, come up with the crown of the head first upwards. The arms to the side and bring the arms again up, breathe in. And out, we're sinking again down. Elbows against the inside of the knees. Breathe in, straighten up the back. And out, straight line up again. Breathe again in, lift the arms up. And out, the last time down. Breathe in, straighten up. And out, straight up. The arms down. Now we're doing the stretch of Venus. Intertwine the fingers behind the back. Bring them over to one side. Breathe in, tall up. And out, turn the head to the side where the hands are. And bring the chin down to the clavicle. Now breathe in. And out, pull the shoulder down and the arm in. Again, in, lift the gaze. And out, over to the other side. Slowly change the position of the arms. Tall up and look over to the side where the hands now are. And bring the chin down to the clavicle. Breathe again in. And out, pull the shoulder down and the arm in. Breathe again in, lift the gaze. And out into the middle. And we're doing the markhor. Breathe in, lift the arms up. Breathe out, bring the arms back, open the chest to the sky. Draw the shoulder blades together. Breathe in, over cross again the arms. Intertwine the fingers, reach high, and reach again in front and hollow the back. Again in, up with the arms, and out and back. Draw the shoulder blades together, over the chest to the sky. Breathe in, over, cross the arms, intertwine the fingers, reach high, and out, reach in front, hollow the back. Again in, and the last exercise, open. The arms to the sky and over the chest, again in and up. And out and back, a second, last time the sky hugger. Again, up. And out. And we're ending with the eagle's wings. Breathe in, lift the arms up. And breathe out, the arms down. Again, in, the arms up. And out and down. And the last time, breathe in, lift the arms up.
Bring the hands to touch and slowly lower the hands down to heart set. That was for standing yoga. Oh no, it was for selected yoga exercises. It was very similar as we did it. I thank you very much and until next time.